Hi, today we'll be discussing about anti-cancer drugs in easy. First of all, what is meant by cancer? It's a disease in which abnormal cells divide uncontrollably and destroy body tissue. For that, anti-cancer drugs are used. Among them, the first subdivision is alkylating agents and other related compounds. First of all, we'll see what does these alkylating agents do. They prevent primarily the cell division by cross-linking strands of DNA. Thus, it prevents cell division. Most of the time, alkylating agents are used to treat lymphoma, leukemia, testicular cancer, melanoma, and further types of cancer. We'll see one by one. First of all, nitrogen mustards. Among them, the basic drugs are cyclophosphamide, estramustin, melphalan, chlorambucil, and then nitrosoureas, lomustine and carmustine, busulfan, thiotepa, triosulfan, cisplatin, carboplatin, dacarbazine. Here is a short way to remember alkylating agents to treat cancer. Let's go to the second division of anti-cancer drugs. As we seen, alkylating agents prevent completely the cell division so that cancer stops from developing. Next comes antimetabolites. These are the group of chemotherapy drugs that mimic molecules that cancer cells needs to create their DNA. When cancer cells use antimetabolites in their DNA, the drugs interfere with the ability to replicate properly. Then cancer cells die. This is a mechanism of action of antimetabolites in cancer. Let's go fast with the type of drugs and examples. Folate antagonists, among them methotrexate, pyrimidine analogues, fluorouracil, cytarabine, gemcitabine. Then purine analogues, fludarabine, pentostatin, cladirabine, mercaptopurine, thioguanine. Then comes the third category, cytotoxic antibiotics. They are also known as anti-tumor antibiotics. These agents are not like antibiotics we take to treat bacterial infection. Instead, they work by changing the DNA within cancer cells to block them from multiplying, sometimes known as anti-neoplastics, which contain chemicals which are toxic to cells, preventing their replication or growth. This is the mechanism of action of cytotoxic antibiotics. Some of the examples of cytotoxic antibiotics are doxorubicin, idarubicin, epirubicin, aclarubicin, mitoxantrone, dactinomycin, bleomycin, mitomycin, procarbazine hydroxycarbamide. Here comes cytotoxic antibiotics. This is the third category. The last category of anti-cancer drugs are plant derivatives. They bind to microtubular proteins of mitotic spindle and prevent cell division during the anaphase of mitosis. Overall, they arrest mitosis and cause cell death. What is mitosis? Is a type of cell division in which one cell, that is mother cell, divides to produce two new cells, that is two daughter cells. Examples of plant derivatives are vinca alkaloids, among them vincristin, vinblastin, vinderine, vinorelbine, taxanes, paclitaxel, dosilatal, etoposide, camphorhexins, among them irinotecan, topotecan. These are four subcategories of anti cancer drugs.